salivary glands. Main salivary glands are two sublingual glands and two submandibular glands and two parotid glands. These are the major salivary glands, while the minor salivary glands are present in the oral cavity, about 450 minor salivary glands distributed in the mucosa of the oral cavity and on the palate, on the tongue, and by histology, they're similar to the mucus-secreting major salivary glands. 10% of total salivary volume by minor salivary glands. إذن الsalivary glands هي three major salivary glands اللي هي sublingual, submandibular, and parotid glands. Two sublingual, two submandibular, two parotid gland, and 450 minor salivary gland. All are mucus secreting gland, but the volume of secretion of minor salivary gland is about 10% of the total salivary volume. Common disorder of minor salivary glands. Cyst, extravasation cyst is one of the most common disorder. The cyst arises as a result of a trauma to the overlying mucosa, usually affect the lower lip. يعني مثلا during trauma, during swallowing, واحد يعض الشفة السفلى مالته يصير عندنا extravasation cyst, producing variable painless swelling that is usually translucent. Some resolve spontaneously, but others need simple surgical procedure and recurrence extremely rare. This is example of the extravasation cyst that arise from minor salivary gland. It is due to trauma, usually by hitting or trauma on the lower lip. This is another example. It is painless and may resolve spontaneously, sometimes require simple surgical procedure. While tumors of the minor salivary glands, histologically minor glands similar to the major salivary glands tumors, unlike the major salivary gland, up to 90% of the tumors are malignant. احنا بالميجر salivary glands الكومنست هي benign tumor، بينما بالminor salivary glands majority of the tumors are malignant, but still rare. Commonly arise in the upper lip, palate, and retromammary region. And the retromaxillary region, retromaxillary region. Rarely nasal and pharyngeal cavity also affected by minor salivary gland tumor, which is mostly malignant, and benign minor salivary gland tumor present as a painless, firm, slow-growing swelling. Overlying ulceration is extremely rare. And then benign tumors of minor salivary gland also present, but painless, firm, slowly growing swelling. And there is usually no ulceration over it. Malignant tumors of minor salivary gland is rare, firm in consistency, and then undergo subsequent necrosis with ulceration as a late presentation. Management of minor salivary gland tumors of the upper lip is by excision to include the overlying mucosa with primary closure. Benign tumors of the palate less than 1 centimeter in diameter can be managed by excisional biopsy, and the defect is allowed to heal by secondary intention. We leave it open and healing by secondary intention. هاي إذا كان موجود over the palate, and if it is less than 1 centimeter, if it is less than 1 centimeter. Tumor of the palate are greater than 1 centimeter in diameter. Incisional biopsy, not total excision, just incisional biopsy is recommended to establish diagnosis of primer to formal surgical excision. This is the picture how to excise benign tumor with a primary anastomosis, primary tumor of minor salivary glands. This is a tumor of the palate treated by excisional biopsy if it is less than 1 centimeter, and leave it open to heal by secondary intention. If it is less than 1 centimeter, if it is more than 1 centimeter, treated by minor, by incisional biopsy. And when diagnosis is malignant, then formal surgical excision will be done, usually with assistance of maxillofacial surgeon. Management of malignant minor salivary gland, management of malignant minor salivary gland tumors of the palate are by wide excision, which may involve partial or total maxillectomy. The subsequent defect can be managed by either prosthetic obliteration or immediate reconstruction. طبعا بالتأكيد نحتاج هنا maxillofacial surgeon وقد نحتاج مع plastic surgeon. إذن at the end of minor salivary gland اللي بيها benign malignant tumor and cyst, extravasation cyst, راح نبتدي بالميجر salivary glands ونبتدي بالسبلينجوال glands اللي هي pair two glands, small paired lie in the anterior part of the floor of the mouth. Each gland has numerous excretory ducts which open directly to the oral cavity in the floor of the mouth. And the common disorders of the sublingual salivary glands, cyst formation also in the submandibular glands, ranula. Ranula here extravasation cyst. It look like the belly of the frog. يعني مثل البطن مالت الضفدع. This is ranula, greenish in color, and usually it is painless swelling, but present in the floor of the mouth, greenish swelling. It occurs in children and young adults, and usually treated by formal surgical excision, sometimes by marsupialization, and sometimes can be treated by oral approach, and enlarged ranulas may be treated by cervical approach. This is the picture of ranula, look like the abdomen or the belly of the frog. This is in the floor of the mouth. Plunging ranula, also it is look like the belly of the frog and present in the floor of the mouth, and may extend to the both sides of the neck. Sometimes arise from submandibular gland, and treated also by surgical excision, by cervical approach and removal of the glands. Smaller plunging granules treated by excision and sometimes by evacuation and marsupialization. This is example of a branching ranula in the left submandibular region. It arises, branching ranula, it arises in this case in the submandibular area and treated by cervical approach, that's to say, from the neck. Tumors involving the sublingual glands are extremely rare and are usually 85% malignant. Even the tumors involving the sublingual glands are extremely rare and usually 85% are malignant. Present as a hard or fair vellus swelling in the floor of the mouth. And the treatment requires wide excision involving the overlying mucosa and simultaneous neck dissection because there is dissemination to the cervical lymphatics. And immediate reconstruction of the intraoral defect is recommended. Submandibular glands, also these are pair two glands, submandibular gland. Anatomically, the glands are paired, lie below the mandible on each side, and that they can be divided in a large superficial and smaller deep lobes, divided into large superficial and small deep lobe. Then submandibular gland lie below the mandible, subdivided into superficial, large part, and deep part, posterior to the border of mylohyoid muscle. Important anatomical relationship, طبعاً هاي مهمة, important anatomical relationships of submandibular gland. First, anterior facial vein over the surface of the gland, facial artery. The deep part of the gland lie on the hypoglossal muscle, closely related to the lingual nerve, and deep part is inferior to hypoglossal nerve. Then the gland is related to anterior facial vein, facial artery, lingual nerve, and hypoglossal nerve. The gland surrounded by well-defined capsule that derived from deep cervical fascia. The gland surrounded by well-defined capsule that derived from deep cervical fascia. Marginal branch of the facial nerve, marginal mandibular branch of facial nerve, is another relation to the submandibular gland. The gland drains through single duct, it is Wharton duct, to drain into the interior floor of the mouth at sublingual papilla. There are several lymph nodes around the superficial part, اللي هي submandibular group of lymphatics of lymph nodes. Inflammatory disorder of the submandibular gland, inflammation of the salivary gland called silidinitis. It may be acute, chronic, or acute on chronic. Even inflammatory disorder, silidinitis, acute silidinitis. It is viral, mumps, mostly due to mumps virus, usually affect the parotid, but submandibular gland also can be affected, and bacteria are more common submandibular than viral. عكس الباروتيد. الباروتيد الviral more common. Bacterial, it is more common than viral. Submandibular gland silidinitis, which occur due to obstruction in the submandibular gland. obstruction due to a lot of causes, either trauma or due to stone or due to tumor, and which are produce painful tender swelling of the gland. And the chronic silidinitis, this is usually chronic or acute on chronic inflammatory procedure that affect the gland. Usually, if there is a stone in the submandibular gland duct with Wharton ducts. And obstruction, most common cause of obstruction is the formation of a stone, silolithiasis in the duct and or the gland. 80% of the stone is radio-opaque and can be visualized by X-ray. 80% of the stone occurs in the submandibular gland duct. It is radio-opaque and can be visualized by X-ray. And the clinical feature, if stone caused complete obstruction of the duct, patient complains from painful swelling in the region of submandibular gland, precipitated by eating. The swelling occurs rapidly and often disappear after 1 to 2 hours after meal. يعني عادة يجينا البيشنت يشكو إنه tender swelling after eating and continue to 1 to 2 hours. If the stone causes partial obstruction of the duct or in the hilum of the gland, usually symptoms more infrequent, producing minimal discomfort and swelling. On examination, we found an enlarged firm submandibular swelling with tenderness on bimanual examination. Pus may be visible draining from the sublingual papilla. Then by examination, طبعا examination of salivary gland نحتاج bimanual examination. Bimanual examination and squeezing of the gland may cause pus to be drained from the sublingual papilla. This is stone in the Wharton ducts near the orifice in the floor of the mouth. This is by X-ray. It is clear. It is a clear radio-opaque stone. 80% it is radio-opaque. This is another picture, and this is the duct, and there is structure in the Wharton's duct. That's to say the duct that drains the submandibular gland. Management, important. Management of stone in the duct of the submandibular gland. If the stone lie within the duct in the floor of the mouth anterior to the point when across the lingual nerve, يعني احنا عندنا duct cross lingual nerve. إذا كانت الستون anterior to it in the floor of the mouth, then can be treated by oral approach. يعني نفتح الduct and we do extraction of the stone and leave the duct open to let saliva to pass. Because the suturing of the incised duct will cause structure and sometimes stenosis. If the stone lie proximal to the lingual nerve, means at the hilum of the gland, so intraoral approach should be avoided because to prevent lingual nerve injury. This is treated by formal surgical excision of submandibular gland. إذن اللاندمارك مالتنا هو اللينجوال nerve. إذا كانت anterior, الستون treated by oral approach. إذا كانت posterior, بالhilum of the gland, treated by cervical approach by formal surgical excision of the gland. Other causes of submandibular duct obstruction, external pressure, particularly trauma to the floor of the mouth, overextended flange on the lower denture, which impinges on the sublingual papillae, causing inflammation and subsequent stricture. This also causes of submandibular duct obstruction. Submandibular gland excision. Indication for submandibular gland excision, the indication silidinitis, يعني inflammatory process and infection of the gland, stone proximal to the lingual nerve, and salivary gland tumors. And the stages of the operation, يعني submandibular gland excision, first incision and exposure of the gland. The incision should be marked at least 3 to 4 centimeters below the lower border of the mandible to avoid damage to marginal mandibular branch of the facial nerve. This is the incision. Gland mobilization. In an inflammatory condition, the submandibular gland is excised by intracapsular dissection. بالinflammatory, مو بالmalignant. The superficial lobe of the mandibular gland is first mobilized. And dissection of deep lobe اللي راح يكون deep to mylohyoid muscle and identification of the lingual nerve. An important landmark in submandibular gland dissection is posterior border of the mylohyoid muscle. Once identified, it can be retracted forward to reveal the deep lobe of the gland. The hypoglossal nerve lies deep to the submandibular capsule and should not be damaged during intracapsular dissection. And wound closure after good hemostasis is confirmed, and vacuum section and radivac drain should be inserted, and the drain remain for 24 hours, sometimes for 24 to 48 hours. 3 cranial nerves at risk during removal of submandibular gland, اللي هي marginal mandibular branch of the facial nerve, lingual nerve, and hypoglossal nerve. And regarding complications of the submandibular gland excision, hematoma formation, wound infection, marginal mandibular nerve injury, lingual nerve injury, hypoglossal nerve injury, transection of the nerve to the mylohyoid muscle, producing submental skin anesthesia. Tumors of the submandibular gland. Tumors of the submandibular gland. It is uncommon. طبعا inflammatory conditions and stone more common than tumor. But a tumor can occur and usually presented with slowly growing, painless swelling within submandibular triangle. Only 50% of the gland tumor benign. يعني 50% malignant. بينما بالسبلينجوال gland كانت 85% are malignant. Only 50% of the gland tumor benign, while parotid gland 80% are benign. In parotid tumors 80% benign, 20% malignant. It is difficult to differentiate, and the clinical feature of malignant salivary gland tumor, usually associated with facial nerve weakness and rapid enlargement of the swelling and induration or ulceration of the overlying skin and cervical lymph node enlargement. Then high features of malignant rather than benign tumors of the salivary glands. Investigations. CT scan and MRI scanning are the most useful technique for tumor arising in the salivary glands. And open surgical biopsy, it is contraindicated and prohibited, as this seeding the tumor to the surrounding structure, but FNA cytology by needle not exceeding 18 gauge to prevent seeding. يعني open surgical biopsy contraindicated, but FNA is allowed. CT scan, MRI, and طبعا بالتأكيد ultrasound is very important in diagnosis of salivary swellings. Parotid glands, also two glands. Anatomically, it's bounded by the ramus of the mandible in the base of the skull. Mastoid process, it lies on the carotid sheath, and 11 and 12 cranial nerve, and extend forward over the masseter muscle. Then in this picture, there is sublingual glands, there is submandibular glands, and there is parotid glands. مهم بالاناتومي انه هنا السبمانديبولار جلاند تلاحظون بيها superficial big and small deep lobe. Structure that run through the gland, parotid gland, large gland, and their structure that run through the gland. Branches of the facial nerve, terminal branch of external carotid artery. External carotid artery pass through the parotid gland اللي تنقسم إلى superficial and deep part, and divided the artery carotid, external carotid, into maxillary artery and superficial temporal artery. There is retromandibular vein and parotid group of lymph nodes. Then facial nerve, the trunk and its branches, terminal branches of external carotid artery, retromandibular vein, and parotid group of lymphatics. And regarding inflammatory disorders, viral infection, mumps, important. Mumps viral infection of the parotid. It is important, it's the most common cause of acute painful parotid swelling, خصوصاً بالchildren. Swelling predominantly affect the children and spread via airborne droplets of infected saliva. And there is a prodromal period of 1 to 2 days. Pain can be very severe and exacerbated by eating and drinking. Symptoms resolve by 5 to 10 days. It is viral disease, لذلك resolution usually occurs by 5 to 10 days. And diagnosis, history, recent contact with infected patient, and the clinical features. Usually there is constitutional symptoms. There is painful swelling in the superior anterior part of the neck. There is fever. There is loss of appetite and feeling of ill. By blood specimen take 10 days apart to confirm the diagnosis by rising antibody titer to the mumps S and V antigens, and a single episode of infection confirm lifelong immunity. and usually the treatment of mumps is symptomatic, treated usually conservatively because it is viral disease, usually to reduce fever by paracetamol, some analgesia to pain because it is intracapsular, swelling of the gland under tension because of infection. It is painful swelling، لذلك نحتاج analgesia ونحتاج طبعا بالتأكيد cold sponge، يعني كمادات نسوي للبيشنت. Viral bacterial infection, acute ascending bacterial silodenitis occurs in dehydrated old age, and the causative agent is Staph aureus or Strep viridans, and treated by broad-spectrum antibiotic, penicillin resistant. If abscess formed, must be drained, and incision in the lower border to avoid damage to the lower branch of the facial nerve. Incision in the lower border to avoid damage to the lower branch of the facial nerve. Obstructive parotitis, papillary obstructive papillitis. Obstructive parotitis is less common than obstructive submandibular silodenitis. إذن إحنا قلنا الtumors it is also common in the parotid gland, but it is more common than submandibular, while inflammatory condition it is more common in submandibular gland and stone formation. Main causes of obstruction are trauma to the parotid papilla, either by fracture of upper molar tooth and subsequent inflammation and edema, and obstruction of the salivary gland. And usually, the symptoms usually painful swelling of the gland and the treatment to relieve the obstruction of the gland. Okay, stone formation in the gland, parotid stone formation is less common than submandibular gland stone, just 20% only in the parotid, بينما 80% in the submandibular gland. Most of parotid stone is radiolucent, بينما most of submandibular gland stone radio-opaque. Diagnosis usually by history clinical examination and scilography or ultrasound examination, and the treatment of the stone of the parotid gland. عرفنا احنا بالتريتمنت مال السبمانديبولار جلاند كانت اذا كانت بالanterior part in the floor of the mouth, anterior to the sublingual nerve, usually treated by extraction, by oral approach, while if it is in the distance of the gland, posterior to lingual nerve, treated by formal surgical excision. While stone, it is rare in the parotid gland and also treated by usually if it is associated with chronic infection of the gland, treated by simple or by superficial parotidectomy. That's to say, excision of the superficial of the gland. Okay, we stop at this subject and we discuss other subjects about parotid gland in the next اللي هي tumors of the parotid gland, be benign and malignant. The tumor will come as هو pleomorphic adenoma in the next lecture. Thank you very much.